Sarah, it is time to talk about your money and what do you need to do right now to get the most out of Medicare. Kimberly Reynolds from the Welch Group joins us to explain. Good to see you this morning.
Good to see you too. Good morning.
All right, so the big key I know you're talking about first right off is you really need to do your homework, don't you?
You do. There's so many options, and if you don't do your homework, it can cost you thousands of dollars.
Talk about the options now. What do people, what are the best options they need to choose from?
Okay, so you have really two main options. You can go original Medicare route, which that means you keep your medical plan separate and you keep a drug plan separate. This costs you a monthly premium, but you have little or no out-of-pocket costs when you go to the doctors. I tell people this is best for people that have health problems and also want the ability to see any doctor that they can as long as they accept Medicare.
Okay, so you're going to pay a little bit more, but it's going to give you a little bit more flexibility, I guess.
That's exactly right. Okay. Your second option is what's called Advantage plans. Many people have Advantage plans that are available that are zero premium, and Advantage plans combine all the components of Medicare. So you have your medical and your drug coverage combined together. The pro is you pay zero premium. If you say a disadvantage is you're usually limited to a network of doctors, so you don't have the ability to see anyone you want to. And then also when you go have a service done, you have co-pays and deductibles, so you could pay high out-of-pocket costs when you do have some medical service performed.
So it sounds like they're going to get you one way or the other.
They will.
That seems like maybe more a la carte, so to speak, a little bit. But now, one thing, a lot of people get confused in terms of the Affordable Care Act and how that would affect their Medicare. Talk about that.
Yeah, so Affordable Care Act has nothing to do with Medicare. They're completely separate, but that's very confusing to many people. But they're completely separate.
All right, and so, if you do need a lot of prescriptions, I guess what you're saying is the original Medicare plan is probably going to be best then?
Well, that's not necessarily true.
Okay.
Basically, it's all individualized. You need to actually have your medications, know whether you take generic or a brand name, know how often you take it, and you have to put it into a system and see what plan's best for you. The most expensive plan does not always mean it's the best. It's all individualized based on what drugs you take, how often you take, and most people have 25 plus plans to choose from. They're done by county, so depending on what county you live in is which plans are available. So it's just you have to check each year and go in.
Now, what if some people are like me? Like I'm what you would call a coachable person. I can't read directions or health plans and figure out what I need to do. I just need you to show me or tell me. And then once you do it, I can mimic it or learn from it. What if somebody's in that boat? Where do they go to get some guidance on this?
The best resource is to go to Medicare.gov, and they have great tools to be able to put in your information, and then it will tell you which plans are best based on the information you input.
Okay, that's simple enough. Kimberly Reynolds, thank you so much. Appreciate it. Good stuff.